I'm Dr. Stephanie Christian. Welcome back to Tuesdays with Timeless. Last week, I talked about treating face veins with laser. This week, I'm going to talk about treating leg veins with laser. Abnormal leg veins can show up looking like a number of different things. They can be lacy and spiderwebby and pink. Those are called telangiectasias. Or they can be more prominent and red or blue or purple, and those are called spider veins. Or they can be deeper and flat, and those are called reticular veins. They look sort of greenish. Now, blood is always red, but if you're looking at them and they're deeper and you're looking through the skin, they can appear green. If those deeper, greenish appearing vessels are ropey and bulgy, those are called varicose veins. So how do these abnormal veins develop? Well, we don't know exactly how all of them develop or what the common thread is, but we do understand a couple things about them. The ropey veins often have abnormal valves. Blood that's coming away from the heart has oxygen that it's going to deliver to the rest of the body. It goes away from the heart. Blood that has delivered the oxygen and is coming back to the heart, oxygen deplete, is going one way. So this whole circuit is unidirectional. The blood that's coming back in the veins often has to go through valves. And those valves are also unidirectional. They let the blood only go one way. But sometimes those valves are damaged and they let the blood go either direction. And that way the blood can pool behind the valves, and that swells the vessels, and then they become visible. That's often what happens with the bulging varicose veins. I don't treat those kinds of veins. Those veins need to be evaluated by and treated by either a vascular surgeon or an interventional radiologist. Other possible causes of these vessels are injury, hormones, because they seem to happen more often in women, genetics, because you often see them in certain families. You tend to see them develop during pregnancy. We're not sure exactly why. Is it that the enlarged uterus is compressing the vessels coming back from the legs, and therefore the blood pools in the vessels, enlarging them? Or is it that the leaves of the vessels have gotten soft and a little sloppy because of the relaxing effect of progesterone from pregnancy? Or is it the relaxing effect of progesterone from the pregnancy on the leaves of the valves in those vessels? So whatever the effect is, once you have those vessels, people don't like how it looks and they come into us to treat them. And the way I treat them is with lasers. There is an alternative, and that's sclerotherapy, where people inject a chemical into the vessel which causes irritation in the wall of the vessel, and the walls stick together, blocking off the vessel so that blood can't go through. Once again, this is not something I do, but if you've had it done and it didn't work for you, then laser is an alternative for that. If you've had sclerotherapy and it worked, but you have tiny telangiectasias as a result, or you have matting of telangiectasias as a result, laser vascular treatment is now the next step. So how does laser work for treating leg veins? Well, as I've talked about in previous videos about lasers, lasers emit pulses of light energy, and I choose a wavelength that's going to target that thing that I want to treat. And in this case, it's the hemoglobin. But I have a lot of different wavelengths I use for vessels, because I use a different wavelength for tiny little pink or lacy vessels than I do for purple or blue vessels, than I do for red spider veins, or that I do for deep, flat, greenish looking vessels. Then when that light hits its target, it's converted to heat, and heat is the tool in this case. That heat causes some damage in the vessel, and ultimately there's a blood clot formed in the vessel. Now, these are not deep vessels, these are superficial vessels, so these are not clots that can go and cause havoc somewhere else in the body. They stay right there. But what they accomplish is by blocking blood flow in that vessel, which ends up destroying the vessel, and the body resorbs that vessel, and it's gone forever. Now, no matter which technique you use for destroying an abnormal vessel, it's not an overnight process. The bigger the vessel, the longer it takes for the body's scavenger cells to go in and eliminate all of the debris of that broken down vessel and the blood clot. And there can be debris there for quite a while afterwards. And as I'll talk about a little bit later, sometimes these can look worse before they look better. What does this feel like? Well, heat is our tool. So it feels a little bit like a hot rubber band snap, but the laser pulse is sent through a cooled tip that is always on the skin, and that cooled tip is cooled to 5 degrees Celsius. That accomplishes two things. First, it protects the skin so that the skin can't be damaged. And the second thing it does is it makes it less uncomfortable. Most adults tolerate this very well. But if I have someone come in and say, I really want these leg veins treated, but I don't deal well with discomfort at all, we have an option which is called Pronox. Pronox is nitrous oxide. It's a 50-50 mix, and it's a little bit like the nitrous oxide that you get in a dentist's office, except that it's patient administered. It's always best to be ahead of pain rather than catching up with pain. And we will tell you to take a certain number of breaths of this until you feel a little bit loopy. And then you stop. And then as soon as you feel any discomfort at all, then you take more breaths until you're not. And then you drop it. And then if you start to feel uncomfortable, then you take breaths again. And it's a way of staying ahead of it. And it's completely safe. And once you've had your last breath, it's completely out of your system 10 minutes later. So you're totally safe driving yourself home. It's not like getting a narcotic that lingers in your system for hours afterwards. There are a couple of contraindications, a couple of types of people who cannot get it. If you've had any air injected into your eye or any air instilled into your colon briefly before getting Pronox, you can't get the Pronox. And this would be something that you knew. So who cannot have leg vein treatment with lasers? Anyone who has phlebitis or thrombosis of the leg veins, we have to wait until that completely resolves. And anyone who's pregnant, we have to wait until after delivery. So what does it look like and feel like after you've had your treatment? Well, there's going to be some redness, and that'll last for a couple of hours. And we do encourage putting cool packs on the treated areas for on and off intermittently for the next couple of hours. Interestingly, it's not uncommon to develop hives in those areas. And if there's any itching that goes along with the hives, you can take an antihistamine. Larger blue or purple or the green appearing vessels often, usually, look worse before they look better. And that's for a couple reasons. First, oxyhemoglobin, which is the hemoglobin in the intact vessels, is converted to methemoglobin, which is one of the breakdown products, and it's simply darker than the oxyhemoglobin, and that will be there until the scavenger cells take it away. Secondly, sometimes there's bruising, and we don't anticipate bruising, but it's always best to plan for the worst and hope for the best. And both of those things can make the vessels look worse. So I always say to people, don't plan on doing laser leg vein treatment in the summer or in the early fall when you might be wearing a bathing suit or shorts or a short skirt, or even capris if we're going to be treating below the hem of the capri. decrease. Plan on doing it during a time of the year when you're going to be wearing long pants and you're going to be covering this up, so you have an adequate amount of time to have complete resolution of the veins. What to expect in terms of post-treatment restrictions? Most people return to work and their normal activities the very next day, but we do ask that you completely restrict strenuous exercise for several days afterwards. Why? Because when you do strenuous exercise, you increase blood flow. And we do not want to try to force blood through these vessels that we have blocked off. The whole purpose was to block off these vessels, and we don't want to try to open them up by trying to force blood through them. That's counterproductive to what we did. You don't have to wear compression stockings after the vessels that I treat. That's more for when an interventional radiologist or a vascular surgeon treats the varicose veins. But if I've treated a lot of vessels or I've treated big vessels, sometimes it feels better if you wear Lycra running tights or running leggings. That little bit of compression will actually help because you've got a little bit of inflammation going on. Everyone, absolutely everyone, has to wear sun protection afterwards. Ideally, I'd like to be doing it in winter or late fall or early spring, and you're going to be wearing clothing over it because clothing is excellent as a type of sun protection. But if you're someone who goes down to Florida or to Arizona, and you may not be able to completely wear long pants the whole time, zinc sunscreen. Zinc sunscreen. It's the only kind of sunscreen that I recommend, and you've got to keep it on the areas that I treated. Why? Because there's going to be inflammatory cells in that area. Inflammation plus sun makes brownish hyperpigmentation, and you don't want to have that be your outcome. We just worked hard to try to replace pink or red or blue or purple or green. We don't want to replace it with post-inflammatory hyperpigmentation. What are the results? Well, we expect you to have resolution of the vessels, but it's probably going to take multiple treatments. The number of treatments is dependent on the number of vessels, the size of the vessels, the depth of the vessels, and the location of the vessels. Over time, it's possible that you'll develop new vessels. We haven't changed your DNA, but if the vessel went away and then you get a new vessel in the area, it's not a recurrence of the vessel that we treated. It's actually a new vessel, and we can treat that vessel with laser as well. How to prevent new vessels from forming? Well, if you're someone who stands a lot at work, wear compression hose. I know they're not comfortable, I know they're not wonderful, but they do work. And don't cross your legs. I am guilty of this all the time, but try not to cross your legs. Both the standing and the crossing your legs causes a pooling, and it's the pooling that causes an eventual bulging of the vessels. So I hope this helps, and if you have any questions or comments, please comment below, and have a great week. Stay well, and I'll talk to you again next week.